We get a lot of questions about emergency measures or measures we take when someone displays symptoms or has an exposure. Some of the common scenarios are things like what happens when a student at school has symptoms. At Montessori schools, that student is taken aside and placed in an isolation room until their parents can come pick them up. And then, according to standard protocols, they're sent home, they're asked to go get tested or see their physician, and they can't return to the school until they either have a negative test or a note from their physician saying it's okay. What happens if that child tests positive for COVID-19? Well, several things. First, the Department of Health is notified and gets involved in performing contact tracing. Second, of course, all parents of other children and any other staff that have been exposed will also be notified personally by the school. Third, there is a change in the classroom organization. So classrooms where anyone who has tested positive will be shut down, all part of the contact screening and tracing protocols. What happens if someone comes in contact with someone with COVID-19 outside the school? So, for example, one of the students interacts with someone who tests positive, but the interaction didn't occur in the school. In that scenario, that student is now exposed, and the best science we have says that person has to stay home, and they have to quarantine for 14 days before they're allowed to return. And so multiple different scenarios are taken into account, whether it be a symptomatic child, a positive exposure, but a potential for multiple siblings in the same class or in different classes. All of these considerations are taken into account to maintain the safest environment possible for your child.